the list of restaurants, go to nycgo.com/restaurant week. All right, quickly, our indicators. Number one, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 279 patients. And hospitalization rate per 100,000, 5.15. Number two, current new cases. Today's number, 4,621. That's on a 7-day average. Number three, percentage of New York City residents who tested positive, 7-day rolling average. Today's report, 8.08%. And now a few words in Spanish. Nos han llegado buenas noticias desde la Casa Blanca. Vamos a recibir más vacunas pronto. Pero algo está claro. Para salvar más vidas es urgente que lleguen rápido. Con esta ayuda, vamos a seguir fuertes en nuestra meta de vencer este virus. With that, let's turn to our colleagues in the media. And please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're joined today by Dr. Ted Long, by Dr. Torian Easterling, and by Senior Advisor Dr. Jay Varma. The first question today goes to Narmeen from Pix 11.
Good morning, Mayor. How are you?
Good, Narmeen. How you been?
I'm doing well, thank you. I wanted to ask you about the second dose issue that you've been bringing this up for a couple of weeks now, wanting those second doses to be released. At this point, you've had a number of conversations with the White House. Any more guidance? My understanding is that you do need federal approval to get those vaccines released as first doses. Again, you've been talking about it for a couple of weeks. Any idea whether this is a real possibility?
Yeah, it's definitely a real possibility, Narmeen, because the most important point was the healthcare guidance from the CDC, where they said last week, knowing that we're dealing with a shortage, knowing we're dealing with a scarcity all over the country, that second dose, we all want it given on the exact perfect day. Everyone would like everything to be perfect. But the CDC said, they're saying up to 6 weeks after that ideal day is still acceptable. They made that a formal advisory. And as Dr. Varma has explained, once you get that second dose, it is fully effective. So whether you get it on your perfect second dose day or a day later or a week later or 2 weeks later, it does not change the effectiveness of the outcome. We, of course, want to be urgent. We're going to get everyone a second dose. We want it to be as close to the exact perfect day as possible. So the CDC has acted. What I want to see is the next step from the federal government and the state government to specifically direct localities to do that. To say we're in a scarcity dynamic, we're in a wartime reality, direct localities to do that, make clear there is no penalty for using second dose supplies that are slated for future times, getting them in play now. So we need that clear, sharp guidance, but there has been a major step in the right direction from the CDC. Go ahead, Narmeen.
Mayor, I also want to ask you about the Bronx. I spoke to the Bronx Borough President yesterday, and their infection rates continue to be the highest among our 5 boroughs. And he said that they need help. He says it's like a game of whack-a-mole is how he described it. As infection rates go up in one particular part of the Bronx, they try to target it with increased PPE, awareness, education campaigns, and then it pops up somewhere else. While we thankfully have this supply boost coming eventually, how do we get a handle of not only just the Bronx, but like the New York Times report indicated, more than about 54 zip codes that have these increasing rates? How do we get a handle of that?
Look, it's vaccine, 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 and supply, supply, supply. And that's the ballgame right now. We are going to keep doing all the things we normally do, Narmeen, the intensive outreach, reminding people of the smart healthcare rules, the testing. We're doing all this stuff. And Dr. Choksi has been really clear. If you're older and you have pre-existing conditions, either or both, don't go out, stay in, really keep your activities minimal, and that's going to help. But the game changer, the only game changer is the vaccine. So it's all about getting the supply and getting it to people who need it and overcoming some of the hesitancy. That's the ballgame.
Next is Michael Garland from the Daily News.
Good morning, Mr. Mayor.
Good morning, Michael. How you been?
I'm good. How are you?
I'm hanging in, brother.
My first question I want to ask you is, there have been a couple of reports today about these efforts to waive the petitioning requirement in upcoming elections. And I was wondering what you thought of that. Do you think that's a good idea? Does the city have any role to play in potentially enacting that? Or is that a responsibility solely of the state?
We're checking that right now, Michael. I mean, look, I think health and safety clearly have to come first here. So I think it's a valid concern. We're going to think about what role we can play in making sure people are safe. I believe a lot of that is governed by the state, but we'll come back with a clearer picture on that. The bottom line is there's got to be a smart way to make sure people properly qualify, but first and foremost, protect the safety of everyone involved. Go ahead, Michael.
Thanks, Mr. Mayor. We did a story a week and a half ago about a shortage of rapid tests. I believe there's a national shortage in the chemical reagent used for these tests, which has affected the supply in the city. I want to say it's the Abbott Laboratories reagent, if I recall correctly. I was wondering if you or one of your health advisors could talk to us about how many of these tests does the city have on hand now, and has this situation changed at all for the better, for the worse? Could you kind of give us a little more detail on what's going on with the rapid test supply?
Yeah, absolutely. I'm going to turn to Dr. Long, but let me just say this. Rapid tests are a good and important tool, but we've always known originally there were concerns about accuracy, then there have been concerns about supply throughout. So I look at it as we have a lot of tools, a lot of ways we're going to ultimately win this battle. But rapid tests, there's always been a bit of a challenge on the supply front. So I just want to frame it and say, unfortunately, in one way, this is not a new problem. Dr. Long, you want to give the latest?
Yeah, absolutely. So the test you're referring to is the Abbott ID Now, which is a rapid PCR test. Anytime in that situation where we have lower supply, we bring in another type of test. So what we're doing is bringing in a different Abbott test called the Abbott Binax Now test, which we have plenty of. We actually replenished, since you wrote that article, the supply of our ID Now reagent too. So we do not have a shortage of reagent now. Even further than that, we have 35 mobile units that are around the city. So in addition to how we're doing testing in our brick and mortar sites, the bulk of our mobile units we've now armed with rapid testing as well, with the antigen tests. So we have plenty of rapid tests that we're moving around the city now, and people vote with their feet. In New York City now, we're regularly doing more than 100,000 tests a day, PCR and rapid tests. So we have the supplies we need, and it's one of the most heartwarming things about my job is seeing New Yorkers see the value in this and coming out to get tested to keep our city safe.
Thank you. Go ahead.
The next is Josefa from the city.
Hi, how are you?
Hey, Josefa, how are you?
Great, thank you. So I'm following up on a story we wrote last night about a vaccination site in Washington Heights that was built to help members of the community that were hardest hit from the pandemic. As it turns out, it seemed that a lot of people from out of town, even out of the state, are getting vaccinated at this site. So I'm wondering, what more could the city do to ensure that the folks who live in these neighborhoods who have been hardest hit by the coronavirus pandemic are getting access to the vaccine? Or what does it need from the state to make sure that some of these hardest hit communities are able to get appointments?
Thank you, Josefa. That's a really crucial question. And I'm going to turn to Dr. Easterling, but first say, this issue was brought to my attention on Friday on a caller to WNYC, and I'm really troubled by what I'm hearing. I mean, here you have a site in the middle of an incredibly hard hit neighborhood, a community largely of immigrants, a Latino community that was one of the places that bore the brunt of the COVID crisis. I want to see Columbia Presbyterian do everything they can to reach the surrounding community. that should be the mandate. That should be the focus of that center, period. There's plenty of people who want the vaccine in the community. That's who the opportunity should be focused on. So yes, it's a private institution, and we'll certainly work with the state on this as well. But the whole idea of a successful vaccination effort must be community-based. It can't be that we're just having central sites that folks who might be more privileged are focusing on. It has to be deep into communities, neighborhood sites, trusted local providers, and community people have to see those sites are really for them. And they're not being somehow left out of sites in their own community. So this needs to be fixed right away. Dr. Easterling, could you speak to either if there has been any engagement with Columbia Presbyterian about this site, or what we could do to start to fix this situation?
Absolutely. Thank you, Mayor. So the site in Washington Heights, that's a state site, but we do know that the Washington Heights site with Presbyterian, they are looking at how they can really make sure that they're prioritizing appointments for residents who do live in that area. But we also know that there are non-residents who do work in New York City who are eligible for vaccinations in the city. And so we know that that is acceptable. But I think, to the mayor's point, we're going to really continue to work with our community-based organizations, our faith-based organizations. And this was a point that we brought up in our interfaith virtual breakfast yesterday. We need our partners. We need them to help with the messaging. And they're also helping to make sure that individuals can get scheduled for appointments. And then for our seniors, make sure that they're getting access to transportation if they need it. So that type of partnership is really going to make sure that we're focusing on those neighborhoods that have been disproportionately impacted.
Thank you. Go ahead, Josefa.
And do you have any update as to when we might be seeing the demographic data for the vaccine? Last night, Gotham has reported that the city had been posting some early data that shows some stark racial disparities in access. Why did the city stop or pull the data from their website?
Yeah, Josefa, I really want to emphasize to everyone, I have said many times in the last few days, literally this data is being pulled together, finalized. It will come out in the next few days. Just to all of you and all your colleagues, couldn't be clearer. We're getting this data to you literally in a matter of days, but it has to be accurate. And part of what we saw in that initial data, it did not give a very complete or consistent picture. The data, as I understand it, that Gothamists had was from the first few days of vaccination, when the only category that could be vaccinated was 1A, healthcare workers. And what we saw was some absolute disparity, but it was disparity based on people's decisions. Healthcare workers were given broadly not only the right to get vaccinated, but it was right there in their own facilities. A lot of people chose not to. Dr. Katz spoke about the experience in health and hospitals, for example. That's someone's right if they're not ready yet. So that early experience is not at all indicative of what we've seen. However, as more and more vaccinations have happened, the hesitancy levels are going down. Also, that early data did not involve community-based vaccination. Now we've started in earnest doing community-based vaccination with seniors. It's a very different picture. So clearly there are disparities we're going to have to address. And clearly we're going to have to deepen outreach. But I don't want a few days of early data when it was just one kind of worker to be mistaken for the larger reality.
The next is Nolan from the Post.
How are you?
Hey, Nolan, how you been?
I'm all right. To follow up on Josefa's question, there's not only this instance of the site in Washington Heights, where apparently the website is only available to get an appointment, it's only in English, and the staff apparently only speaks English. There have also been complaints about the lack of translated materials for the city-run vaccination sites too. Local community activists on the Lower East Side have told us the materials are only available properly translated in Spanish. There's no proper translation yet for Chinese and some of the other major languages here in the city. So one, does the city have the authority to order private hospitals and other facilities to make their materials available in other languages? And two, why is the city behind the ball in getting these materials available in languages other than English and Spanish.
All right, let me test the question with Dr. Easterling and Dr. Long. Obviously, between their two agencies, a lot of test sites that have a long, and by the way, Department of Health and Hospitals have a long and really positive history of reaching out to all communities in all languages. So I want to ask them in a moment if what you're hearing, Nolan, is accurate, and if it needs to be addressed, and it obviously does need to be addressed, we should do it forcefully, and we should ensure that every institution does the same. The Washington Heights site, if it's true that the appointments are not available in Spanish, that's mind-boggling to me. And Dr. Easterling will follow up again with Columbia Presbyterian and the state to get that resolved. But we want to make information available in every language. Our Vaccine Command Center has, among its many responsibilities and missions, to make sure that vaccine distribution is equitable and effective on the ground and decentralized and grassroots. And that means using multiple languages. So Dr. Easterling, Dr. Long, what can you tell us?
Yep, yeah, absolutely correct, Mr. Mayor. So we are making sure that we have staff on site to receive individuals and be able to respond to them in their languages, certainly English and Spanish. Our materials are also being printed in English and Spanish. And so we can certainly follow up if there are ways that we need to address and we need to fill those gaps, we can certainly do that. Also on our website, our frequently asked questions can be translated as well in the top 13 languages. So this is something that we certainly strive to do to make sure that we are being responsive to our diverse community.
Thank you, Dr. Long.
Yeah, what I would add to that, and I completely agree with everything Dr. Easterling said, is that we have our language line that we use every single day in New York City Health and Hospitals that we use for the phone line that you call in, Vax for NYC, to be interpreted to any language. And also staff on each of our sites have access to that same language line. That's the same language line that we use, by the way, in my personal primary care practice in Morrisania in the Bronx. I have one patient who I always think about when I think about the language line. She speaks a rare African dialect, and in her life, not many people can really communicate with her because it's not a commonly spoken dialect. But every time she sees me, she smiles because she knows that the language line in my clinic will enable me to effectively communicate with her. Every person that comes to one of our sites or that calls the phone line has that same access. Elmhurst Hospital is the most diverse hospital in the entire world. That's exactly what they use there too. So New Yorkers coming in for vaccines, calling us, or there in person, get the same quality care that we are world experts in New York City Health and Hospitals.
Thank you very much. Go ahead, Nolan.
All right, so just to clarify, because there are two separate health systems in the city, you have the public health system and you have the private health system. Does the city have the authority to order private health systems to provide materials in multiple common languages in the city? Secondly, in terms of the public health system, we're told that completing the applications to get appointments, all the information you have to provide about your healthcare history, your insurance, whether or not you actually tick the boxes and you are eligible, that those applications are only available in English and Spanish. And the best that the city's doing right now for other common languages in the city, like French Creole, Chinese, Hebrew, Russian, etc., is a Google Translate function that doesn't carry over to many of the application pieces. So when will all the information you have to submit, when will those forms be available to the public health system in languages other than English and Spanish?
Very good question, Nolan. I really do appreciate it because we got to get this right. And it's a huge sprawling effort, but we got to make sure it is inclusive as possible. So I'm going to open this up to whichever doctor, and we have Dr. Varma as well, whoever wants to start on the authority to require private health providers to provide information in other languages. I don't know, and we may have to check counsel on that one, but does any of the three doctors know if that can be a direct order, or is that something we have to do through collaboration? It sounds like none of them are sure. We're going to come back.
No, we'll have to do through collaboration.
Go ahead.
Yes, we've already been in touch with Presbyterian, so we will follow up.
Okay. We thank you, Nolan, because that's one, if we don't have the ability to order it, we have to really very aggressively make sure, and Torian, if you'll take the lead on this, that we're checking with every hospital to make sure they're doing it. If they need some of our help doing it, we can do it. on the question of the forms, the signups, the applications for our appointments, they really do need to be in multiple languages as this grows out. So again, any of the doctors have an update on that, how we're going to move beyond English and Spanish? And if not, we'll get back to Nolan with a more specific timeline. Does any one of you have an update?
No, sir, no specific update at this time. We will follow up with Nolan to make sure that he also has an update.
Thank you.
I would just Ted, if I may, I would just add, Nolan, that this is one of the reasons why we set up the language line within our phone system, is so that if you have trouble completing the forms, you have a place you can go, you can call, where somebody can help you to register for your appointment. And again, when you call that line, you have access to many, many different languages and dialects. And it's the same thing I used to treat my patients in the Bronx.
No, I appreciate that. And that is not a minor matter, Ted. That's a great service. I know it's been incredibly helpful. Your example of the woman who's your patient is a great one. But Nolan's raising an important point. I'll say, you got to give credit where credit is due. When the New York Post is right, they're right. And this one, he's right. The actual forms to sign up for the appointments need to be in languages other than just English and Spanish if we're really going to maximize access. So we will get to work on fixing that. Go ahead.
The next is Rich Lamb from WCBS 880.
Morning, Mr. Mayor. Good to talk to you and everybody on the line.
Rich, I'm going to interrupt you if you'll be so kind. I heard your news, and I have to just take a moment before you ask your questions, just to tell you it has really been a privilege serving in public life with you. And I mean it. You are just as good as it gets in journalism, and you're someone with an incredibly good heart. I know you give a lot of time of yourself volunteering and helping outside your work, but you've really shown everyone, a great example of a compassionate and decent approach to getting people the news they need. And really want to thank you. And I can tell you, the people in New York City are going to miss you.
Well, I'm blushing, obviously, and thank you very much. I'm very humbled to have had this privileged status of being able to ask you questions and previous mayors questions and do the stories that came out of it. So thanks for that. But I do have a question here, and it's about the vaccines. So we know that that the supply of the vaccine is the big issue. But why, I haven't heard it explained why, we heard everything beforehand was that, they're making millions of doses of this vaccine in advance. And once they pull the trigger, boom, here we go. What is it, the manufacturers? Is it the distribution network? And I know the previous administration gets some blame, but what's happening right now? Why is it we can't get this thing rolling?
I'm going to give you my perspective. And then, Dr. Varma may have something to add because he's really watched this process carefully all over the world. Rich, my simple answer would be this. I'm going to say, and I have said before, give the Trump administration their share of credit for having sped the vaccine development process so that the vaccine actually showed up in December. That's a pretty big deal. But what didn't happen throughout the whole crisis, including on testing, including on PPE, was truly creating a national mobilization. I spoke to President Trump many times about this. I spoke publicly many times. I think the military should have been front and center. I think the Defense Production Act should have been used to the fullest. I think private companies should have been put on a public basis for the purpose of solving the greatest crisis, arguably in American history. That didn't happen. And that example I gave earlier of Merck, how is it that a massive pharmaceutical company that was trying to make their own vaccine, they couldn't, they're just sitting there going on with business, doing other things, instead of being ordered to produce the vaccines we do have? I think there's a lack of assertiveness and ownership in the White House in the previous administration. There's a chance now to fix that. Joe Biden is moving in the right direction. Jay, you want to add anything?
Yeah, I'll just try to clarify a little bit on this. To be perfectly honest, we don't have insight into which steps of the vaccine process are result in certain delays. But to give you just some insight into this, these are just incredibly complex processes First, you have what's called the vaccine ingredients, which are all of the components that are needed to assemble and create the RNA that's used, as well as the packaging around it, which is a fat package. It's called lipid nanoparticles.
Okay, Jay,
Then
don't get in too deep here.
Together.
Jay, I'm interrupting
Okay.
you. We don't need the
got
whole
it.
history
No
of
problem.
vaccine. The bottom line question is, what could have been done to speed it up as best you know?
Yeah, at this point, I'm not sure that there's anything that we know about what would have sped it up. My understanding is all of these U.S.-based companies have really dedicated all of their resources to producing this and getting it into hands as quickly as possible. It's really about this last mile allocation from manufacturing point to where we need to distribute.
Right. I do think, Rich, that's crucial. The supply chain issues obviously are very real. And again, I think the military is not being used sufficiently in that. But I keep coming back to, if business as usual isn't working, then don't do business as usual. Get the other companies on a footing where they're serving the national interests at the direction of the federal government. That's what happens in wartime, and that's what should happen here. Go ahead, Rich.
Okay, and I really neglected to thank you for your kind words, and I do appreciate them. My other question is, now it's my understanding, and I didn't hear him say this, that Governor Cuomo has apparently ruled out the use of the second doses as first shots. And you're still appealing, I guess, to the federal authorities about this. And if they were to give you the green light, would you be able to go ahead with it over the governor's objections, or do you think that would be a problem?
I have not heard a particularly specific statement from anyone at the state on this. They may have said it, I haven't heard it, but let me be clear. I'm saying this is not just for New York City. This should be for the whole country. I think the federal government should direct state governments and local governments to use second doses that are waiting. Again, as of 2 days ago, I know the number changes every day, but as of 2 days ago, we had almost 100,000 doses waiting for at least 2 weeks to be administered, just sitting there in reserve. That's what I object to, Rich. Doesn't make sense. We have tens of thousands of people who want to get vaccinated now, who want a first shot to give them some kind of protection. Think about the seniors in your life. Think about the people you love. The difference between getting a first shot versus getting zero, getting nothing. So I think it should be a federal directive that second doses get put into play, particularly as we're seeing evidence that more and more production is coming, including soon Johnson & Johnson. It just makes sense to use everything you have now with backup coming soon. Go ahead.
The next is Matt Shays from Newsday.
Hey, good morning, Mr. Mayor, and congratulations to Rich on his retirement. My first one is, there are instructions on the city's frequently asked question webpage that appear to conflict with your rules for who's eligible to be vaccinated at city sites. I'm quoting here, if you are eligible for a vaccine based on your age, you must show proof of age and New York residency. And other instructions on city web pages and your instructions at these briefings explicitly say that someone needs to be a city resident. So what happens to first, what's up with that? And then the second is, what happens to someone who got a first dose from the city, probably who shouldn't have, and are they, out of luck for getting a second shot from the city? Like, what do you do with these people?
Yeah, I don't want to govern by exception, Matt. It's a fair question, but I want to say, the city provided sites, health and hospital sites, Department of Health sites. We are adamant. We are here to serve people who live in the 5 boroughs and folks who happen to live outside the 5 boroughs, but serve us in hospitals, fire department, police department, education, you name it. That's our focus. These are public agencies here to serve the public. That's what we're going to do. The private hospitals, obviously governed by state regulation. That's a more challenging situation. We have more work to do on this, but I would say the obvious. A private hospital in New York City should focus its efforts on people who live in the 5 boroughs and folks who serve us in the 5 boroughs, because all the surrounding counties are getting their own allotments of the vaccine. Folks who live in other counties should go to the distribution sites in their counties and get their vaccine. That is the fairest outcome. But with the private hospitals, we have some more work to do for sure. Look, Matt, anyone who gets a first dose should not be deprived of a second dose, obviously. But I think the important thing, and that example from Columbia Presbyterian Washington Heights is crucial. we have got to be rigorous about making sure vaccine in New York City goes to the people of New York City. Go ahead.
On a related matter, we've spoken with youths who are volunteering their time to help older folks who are basically incapable of navigating this like opaque thicket of 5 websites and phone numbers and all that. To what extent are you looking to have helpers, whether young people or other volunteers, help all the older folks deal with, navigate this bureaucracy?
I think it's a great question how we can continue to simplify the application process, and we need to, and that work is going on now. I think it's also a great question whether we could get some kind of facilitator system going like you're suggesting, whether it's younger people or city employees or whoever it is helping out. So I'm going to take that as a very helpful suggestion. I thank you for it, Matt, and we'll come back quickly with an answer on that.
We have time for 2 more for today. The next is Chris Robbins from Gothamist.
My first question is about high schools and middle school principals. They are awaiting guidance on when they can reopen for in-person learning. Some expected that to happen in February. When will you communicate a plan to them, and how likely is it that they'll actually reopen for in-person learning this semester?
So I want to see schools continue to open up in this school year, now through June. And then I am adamant that based on everything we're seeing now, we'll be able to come back full strength in September. The trajectory, Chris, is simple. We would start with middle school next, work our way up to high school. It will certainly take time. We need to make more progress with vaccine. We need to make more progress beating back just the sheer number of cases and the question of the new variants. Obviously need to expand testing capacity. But I want to see middle schools come back as soon as possible, and we will provide guidance during February for what that process will look like. Go ahead.
Okay, thank you. My second question is, I wanted to ask you about the NYPD disciplinary matrix that you announced earlier this month. Is the department going to apply the matrix to existing instances of misconduct? So for instance, if an officer currently on patrol has a substantiated CCRB complaint for using an illegal chokehold in 2019, will the NYPD then use this matrix to look at that officer and administer the corresponding discipline?
Yeah, any case from this point on, whether God forbid it's a new situation or something continuing from previous charges, this is now the law of the land. The matrix is abundantly clear that, for example, in the case of a chokehold, there's a charge against the officer that used the chokehold. There is due process. Again, we all believe in due process. If the due process yielded, yes, you used that chokehold, the punishment is termination. It's clear as a bell, and that will be applied immediately. Go ahead.
Last question for today goes to David Brand from the Queens Daily Eagle.
Hi, Mr. Mayor.
Hey, David, how you been?
Good, thanks. At this point, when do you expect that everyone in New York City jails will be vaccinated, or at least have access to the vaccines? And how will the city follow up with people if they're released or transferred before their second dose?
I don't think whoever's there liked your question, David. The guidance right now, as I understand it, and because correctional health is part of health and hospitals, Dr. Long may want to add. My understanding is we had about 500 folks in our jails, inmates, who were authorized to be vaccinated because they were high risk. And that has been moving along steadily. There are certainly some of those folks choosing not to be vaccinated, just like we're seeing in our larger population. A second, with correction officers and staff, that vaccination effort is ongoing. We're building that out quickly. Again, we're certainly seeing some people who are choosing not to be vaccinated. So we're fully authorized to do officers and certain inmates, but not all inmates is the last guidance I heard. Ted, anything you want to add?
No, you captured it. Thank you, sir.
Thank you. Go ahead, David.
Okay, cell phone video from a January 3rd arrest appears to show an NYPD officer in Queens kneeling on the neck of a man during a misdemeanor arrest. On January 7th, you tweeted this quote, "After George Floyd was murdered, we passed a law to ban chokeholds and kneeling directly on people's neck. I've seen the video from a recent arrest and I'm deeply disturbed. A full investigation is underway and I demand immediate answers from the NYPD." It's been nearly 3 weeks since you said that. What immediate answers have you received?
My understanding is the officer was modified. That certainly constitutes an immediate answer. And the investigation has to be completed. And then if there are charges, there has to be obviously the due process. So I'm waiting to hear the results of the investigation. What I saw was one clip of video, but investigation is going to look at everything and talk to witnesses and get the full picture. What I saw, I didn't like one bit, but I want to hear the results of the full investigation. All right, everybody. Just to say how important it is, how extraordinary it is, how wonderful it is to see what we saw yesterday. The President of the United States totally owning the situation, focused, leading, saying bluntly, clearly, we're going to keep expanding supply. We're going to make sure it gets down to the grassroots. That was a shot in the arm for all of us. This is how we move forward. And our job here in New York City is to meet that moment. Every supply we get is going to be used right away. The more vaccine we get, the more people we can help. We can do 500,000 vaccinations a week. We are ready, willing, and able. And it is so nice, so powerful, so good to finally have a partner in Washington leading the way and helping us get the job done. So something to celebrate today in our city. Thank you, everyone.